Namaskar, welcome to Break Time Vartalap. October, also called as Pink Month. Why? Because it is Breast Cancer Awareness Month. So, what does this mean? Pink ribbon has a different story overall, but what Pink Month stands for me is supporting the fighters, admiring the survivors, and honoring the taken, and never ever giving up hope. This month is very special to me, and honestly, from past 5 years, I have been thinking of doing something this month. The reason why it is special to me is because my mom is one of the breast cancer survivor, and she had been through a journey which was, I would say, a journey not for herself but for the entire family. We learned a lot from her journey, and I would humbly thank you all the doctors and all the supporters who had helped us coming out of it. But today we are very fortunate to have one of the very renowned doctor talking us about breast cancer awareness. We have Dr. Tapan Saikia. He is one of the best medical oncologists. He's working in Mumbai from past 40 years, and he is here. Basically, we requested him to give piece of advice on how to prevent breast cancer, what are the awareness, what are the symptoms that we see, and what should be your state of mind during this whole journey.
Greetings to you all. My name is Dr. Tapan Saikia. I'm a medical oncologist working in Mumbai for the last 40 years in the field of oncology. October being a breast cancer awareness month. The awareness of breast cancer is very important because incidence of breast cancer is increasing across the world. No country, no society is spared. Women above the age of 30, 35 years, certainly above the 40 years of age, should be conscious that any swelling happening in the breast, usually it is painless. It might be moving, but it might not be moving. It might, on touch, it might feel firm, soft, or hard. The skin might be involved on top of it, looking a little abnormal. Then you should be aware that something else is happening. Sometimes there will be secretion from the nipple, milky secretion, clear secretion, pus-like or blood, anything that keeps on happening made you aware that you should go to a doctor to seek an opinion. Sometimes a swelling might come in the armpit, so disease might start in the breast but might have spread already to the armpits. That's also another symptom. Other symptoms when the disease has spread to the other parts of the body might come up, but those are rare situations, not very common. How do you stay away? Take precautions about it. The number one is the self-breast examination while having a bath. Women above the age of 30, 35 years should be examining the breast at least once a month with the palm of the hand in the circular fashions. If you feel any kind of swelling, it's time that you watch it for a while, and if it doesn't go away, you should go to a doctor. Next one is mammogram. It's available in many parts of the country and across the world. Mammogram has saved many lives because if your disease diagnosed at an early stage, minimum treatment can cure breast cancer. So those patients detected with a stage 1 or 2 disease have an excellent chance of getting a cure from the combined treatment that's available today. Yes, mammogram could be controversial, especially in the very early stage. So those are the things an experienced doctor or a team of doctors will clearly explain to you. But that doesn't mean that mammogram should be forgotten at this point of time. Next point is about the family history of breast cancer. Breast cancer can run in families, but majority of the breast cancer that we see in our clinic that's happening across the world, usually not familial. Majority they happen, but there are familial breast cancers. If you have a very strong family history of breast cancer, ovarian cancer, there's a cancer of the ovaries, so you should be conscious about that So if mother had, a very close aunt had, first degree relatives have had it, so they have a slightly increased risk. But there are families known to have breast cancer. So that's why genetic counseling is required about the breast cancer awareness. It should not be taken very lightly. We doctors also should not be counseling people during a clinic visit. One should take an appointment, discuss in detail about it. It takes time to discuss about the breast cancer family history. So it's important but should not be taken very lightly in our clinics. You have a breast cancer. You never expected it. Nobody wants to have a difficult disease. But you cannot look back. You can only look forward. The past can be a learning process, but you cannot brood over it. You have to take care of tomorrow, and that tomorrow starts today. Stay positive. Go to a proper hospital. Meet a team of doctors. Get investigated properly. Understand everything. You should have many questions about, and the questions you should ask, and you must get answers. And then you would know that how you should go about getting treated, how to stay positive during the treatment. Sometimes complications do happen because of the treatment, how to overcome. The team of doctors and the supportive staff in the hospital will help you. And at the end of treatment as well, you should stay positive. You should stay normal. Doesn't mean that you have a disease. You should stay inactive. Good physical activities, meditations, good food, exercise, taking treatment on time, seeking help from the family and friends help a lot. Stay positive. It's very clearly shown in scientific research that those who stay positive during the treatment, they're the ones who have defeated the disease. So it's important. Thank you very much for listening to this short video.
Thank you, Dr. Sakya, for your kind words. And honestly, you have supported us so much throughout this journey. How much I can thank you, it would not be enough. At the end, I can only say you can choose to be a victim or a survivor. It's your mindset, what you want to be. And you can either choose to be this bird or this bird. Thank you.